Hi guys, it's Dr. Jen Caudle, and I'm back with the Be Your Own Doctor series, and this segment is one you've been waiting for. Today, we're talking about what the best treatments are for fibromyalgia. Now, I've done many segments on fibromyalgia. Many of you know this. We've done the fibromyalgia series. We've covered what is fibro, what causes it, and how is it diagnosed. And many of you also saw my Dr. Oz episode when I talked about fibromyalgia on air. If you haven't, make sure you check the comments. I've got links for you guys. But the biggest thing you all ask me about is how can you feel better? How can fibromyalgia be treated? And that's what we're doing today. And if you're new to my channel and you're looking for up-to-date health information, or you're looking for health tips you can use on a daily basis, or you simply like that quirky health stuff, I'm your girl. Make sure that you click the subscribe button and hit the little bell to get updates. Oh, and guys, watch to the end. I got lots of stuff for you. Don't go anywhere. Okay, we're just gonna jump right into it because if you're anything like me, you don't like any long, drawn-out YouTube videos, okay? I'm like, let's get to the point, people. Okay, so let's set the stage here. Let's say you have fibro or a friend or family member, a loved one. So what's going on? There's widespread pain. There's also other symptoms like waking up feeling unrefreshed, you're not sleeping well. There's also memory issues or what we call fibro fog, cognitive issues. But you also might have anxiety, depression, irritable bowel syndrome, headaches, GERD, you name it, the list can go on. And I know that you know this. By the way, if you're new to fibro or you're just learning about it and you want to get up to speed, you're probably like, what's going on here? Just check the comments. I've got links to my other videos where I talk about exactly what fibro is and how it's diagnosed. I break it down for you. So take a peek at that. The first thing I want you all to know is that fibro is not in your head. I have said this before, I'm going to say it again. People, your family, your friends, even doctors may make you feel like you're like, woo, woo, woo. No. Fibro is a real condition. So please don't let that get you down. The second thing that's so important when we think about fibro treatments is to understand that a multimodal approach is generally the best way to treat this condition. It's not one thing that does it. It's not one medication, one treatment. It's going to be a number of things. First thing I want you to know is that there are three FDA-approved medications for fibromyalgia. That's pretty awesome, right? So for all those people who may say, fibro ain't no condition, fibro ain't real, well, wait a minute. Does the FDA approve medications for conditions that are not real? I think not. Those three medications are, by the way, just so you can look them up or talk to your doctor about them. One is Cymbalta, one is Savella, and the other is Lyrica. Disclaimer, I'm a family doc. I don't get kickbacks. I'm not endorsing any medication or any of that jazz. I just want you to have the information that you need to know. There are lots of other different medications we can use as well. This is really important because this is part of our toolkit that we can use to help treat your fibro symptoms. So we may pull from different classes, things like anti-anxiety medications or antidepressants. We may also pull from, say, muscle relaxants or anticonvulsants. But there are other classes as well. Medications that help with sleep might be something that we do. Analgesics to simply help with the pain. There literally are many different classes of medications. Those are just a few that we can pull from to help your symptoms. So if your doctor tells you there's nothing that can be done and there's not a medication that can help you, that's not true. So let's talk about how to deal with the pain that doesn't involve a medication. Some therapies that have been really great for my patients with dealing with their pain are things like physical therapy or occupational therapy. I have some patients that have done really, really great with massage. Osteopathic manipulative treatment, that's a treatment that's excellent. In fact, we demonstrated that on the Dr. Oz show. That's kind of what you're seeing right here. OMT or osteopathic manipulative therapy can be awesome. But also other gentle activities like yoga or Tai Chi, sort of gradual exercise programs can be great. Water therapy, aquatherapy, can be amazing. Now, the next thing I recommend for many of my patients with fibromyalgia is something to address how they feel. Our mood and our mind are so powerful. And for those of you who have chronic pain, you know that not only does chronic pain take a toll on your body, but it can take a toll on your mind as well. It can be downright depressing. So often, things like cognitive behavioral therapy or other psychotherapy can be very, very important to really have a chance to talk about how you're feeling, to talk about what you're going through, and help you cope with this literally lifelong condition. The next thing is sleep. We've got to make sure that we're sleeping well because we know what it feels like when we don't sleep well. And not getting enough sleep or feeling refreshed just makes fibro even worse. So talk to your doctor about ways to get the best sleep at night. The last thing is what we should be doing regardless of whether we have fibro or not. And that is taking care of our bodies from the inside. That means eating healthy, nutritious foods and making sure that we're getting gentle, graded exercise at the level that we can do it. But the idea of taking care of ourselves from the inside is absolutely important to treating our fibromyalgia. Guys, I hope this was really helpful and gives you some ideas for ways that you can treat your fibromyalgia even better. Remember, if you guys want up-to-date health information, if you want tips you can use on a daily basis, or you just want to know about that quirky health stuff, that is. Again, I'm your girl. Make sure you subscribe to my channel and click the little bell to make sure you get updates.